all KEMSA staff allegedly working from home to go back to work with immediate effect, in a move aimed at streamlining the Human Resource Department in the agency. Nakhumicha was speaking during the inauguration of the new KEMSA board members following the suspension of some members following anti-malaria net scandal. Elizabeth Atieno now tells us more.
3 days after the entire KEMSA board was sent packing after allegedly bungling a 3.7 billion Kenya shillings anti-malaria nets procurement process spearheaded by the Global Fund. The new board, appointed by Health Cabinet Secretary Susan Nakhumicha, has officially assumed office. The new board is led by Irungu Nyakera, who is now the chairperson, replacing Daniel Rono. Dr. Andrew Mulwa is the acting CEO following the suspension of Terry Ramadhani, who served in the agency since May 19, 2022. Other members also inaugurated on Thursday are Hesbon Omolo, Bernard Kipkirui, Jen Masiga and Jen Bhatia.
There are people who are interested in enriching themselves on the backs of patients. Those are the people that I want to deal with them.
The first task that now awaits the new board is to ensure that all the 375 KEMSA employees allegedly working from home for 19 months now report to work at 8 a.m. on Friday the 19th.
It does not make sense. It is irresponsible to have paid over 200 people for 2 years, them sitting at home in the name of COVID. Yet we all go to our offices nowadays.
However, there still exists a cloud of uncertainty among Kenyans, considering that this is not the first time that KEMSA board is witnessing some changes.
Let me also say that we have individual culprits who taint the image of this institution. I will not stop at anything. Even if it means sending home a whole department, I am ready to deal with it.
In August 2020, the then KEMSA CEO, Jonah Manjari, was suspended due to the 7.6 billion COVID-19 scandal. His position was then occupied by John Kabuchi, who served in an acting capacity. In April 2021, the then KEMSA chairman, Kembi Gitura, was also suspended and replaced by Mary Mwadime, whose appointment was also revoked in February 2023. Questions now abound if the new faces will save the face of KEMSA, or will the country witness another case of the same forest with different monkeys.
And I said I might not have any other muscle, but I will name and shame anyone who is brought to my attention. Investigation is done, and they are known to have caused problems in this institution. We must move forward as a clean institution.
The Ministry of Health now reaffirms that the botched 3.7 billion procurement deal with Global Fund will proceed through the wambo.org website.
We have mosquitoes all over, and we don't want Kenyans to suffer. So based on that, I'm in agreement with them that they proceed with the procurement. In terms of quality, we all know that the specifications of the net are determined prior and during the budgeting process. Therefore, it is our expectation that Global Fund is going to buy as per specifications.
The Ethics and Anti-Corruption Commission is currently investigating the anti-malaria net scandal after receiving the report from the Ministry of Health. The findings will then be presented to the Office of the Director of Public Prosecutions. Elizabeth Atieno, TV47, Nairobi.
And from the health scandal, let us